It's always a pleasure to be here. So I will talk a little bit about the data that was presented at the end of the morning today about mastectomies and lumpectomies and the economical burden behind those. And I know that's a very hot topic for our advocates and really a place that we can educate our patients. So the first study was a study done in Netherlands where the researchers looked at their database and they looked at 37,000 women that had either undergone a lumpectomy and radiation or a mastectomy. What they showed in that study was that regardless of what the stage of the cancer was in those women, the women that had a lumpectomy and radiation had a better survival than the women that had a mastectomy. Now you'll say, well, what does that mean? Should every woman have a lumpectomy because she's going to live longer? Remember, those are studies that we look at large data sets going back. We don't have a lot of information. So please don't take that to mean that women having a lumpectomy will do better than women that have a mastectomy. Probably take it to mean that if you can have a lumpectomy, it's a safe procedure to do and probably preferable to removing the whole breast. The second study was a study that looked at, again, women that had chemotherapy before they had surgery, and some of the women had a lumpectomy, some had a lumpectomy and radiation, some had a mastectomy, and some women had a mastectomy and radiation. And what they were able to show was that the women that had the lumpectomy and radiation did the best. Now again, this is a difficult study to interpret because women had chemotherapy prior to those procedures. And those procedures really were dependent on how large the tumor was. And you can imagine that if the tumor was very large, women ended up having a mastectomy. And obviously, women that had large tumors wouldn't be doing as well as women that had smaller tumors. So that was a very biased study. And I want to make sure that we all recognize that. Also, it was pretty unusual that a small group of women only had a lumpectomy and didn't even have radiation, because that's a pretty standard approach in this country. So, and one of the attendees asked the question of what happened to these women? Were these women not followed? Why did these women only have a lumpectomy? And the presenter really didn't have the data to answer that question. Now, the third study is actually very important, and it talks about the economic burden as well as complications from the different surgical procedures. Women, this was a study that was done at MD Anderson as well as the University of Michigan. And they looked at Medicare claims. They looked at claims from MarketScan, which looks at all the other private insurances. And they looked at women that have had a lumpectomy, women that have had a mastectomy, women that had a mastectomy and reconstruction. They looked at complications from these procedures, and they looked at cost. And as you can imagine, women that had a lumpectomy without having a mastectomy, without having reconstruction, had the fewer complications and the lower cost. Now, women that ended up having the mastectomy had 2 times the amount of complications than the women having a lumpectomy. And as far as the cost, you really see that it's a pretty large sum of money that those women spend and the healthcare system spends by doing mastectomies and reconstructions. So by kind of summarizing all that, and really we have to take that into perspective and see how are patients and physicians deciding on whether to have a mastectomy or a lumpectomy. And what we've seen in the past few years is that the rate of mastectomy is increasing. And part of that has to do with the women's fear of having a recurrence or having a second breast cancer. And we have to educate our patients. If a woman can safely have a lumpectomy and remove the whole cancer and then have radiation, that is at least equivalent to having a mastectomy. If a woman cannot, or if a surgeon cannot remove the cancer with a lumpectomy, then she has to have a mastectomy, and that's okay. But having a mastectomy, because of the fear of recurrence or because of the fear of a second cancer, really doesn't make any sense. Those women won't live longer because they had that mastectomy. And they may have more complications, and also it might cost them and the healthcare system more money. So those are kind of the points from those 3 presentations, and I'm sure we'll have some discussion at the end. Thank you. Thank you so much.